I'd like to introduce Catherine. Well, maybe she doesn't need an introduction. She's part of our design team. She participated in the design of the Genius system, but she's not going to talk about the Genius system. She's going to talk about what we are making progress with artificial intelligence. What is the destination? And I'd like to give her the chance to tell you about artificial intelligence. Well, I'd like to thank Charlie for having asked me once again to deliver a presentation during the Genius Summit. Every time I share with you my projects and I want to talk about innovation, and the Genius Summit is the perfect forum to talk about innovation. I am not an AI specialist, but I participated in the development of clever liners, so I'm, quite interested by the topic, and I'd like to share with you my thoughts about artificial intelligence and especially the role it can play in our practice. My daughter, who is studying to be a dentist and wants to become an orthodontist, recently asked me, "Mummy, do you think that orthodontics have a future? Because we hear so much about AI and the future of aligners that I doubt about the future of orthodontics." And I have recently invested in a big project, so I started having a few doubts, but I said, no, honey, I'm sure orthodontics still have a bright future, but still, we should think about it. Now, my professional career started 20 years ago in Maison Lafitte near Paris, west of Paris. I bought a practice and it was a relatively small private practice, but I always wanted to grow my practice over the years with the evolutions, both in terms of technology. I was trained with tweed brackets, straight wire, and self-ligating brackets, which were a revolution, and lingual orthodontics and aligners. I have trained myself on all of these techniques and technology, including intraoral scan and 3D printers. And now I'm going to train myself for injections, because you have to be abreast of the new technologies and you have to move on. Now this slide show has stopped, but this is my future practice. Here you can see the house that I just tore down to build it anew for my new practice. Well, the take-home message is that I invested in this new practice, and I worked with an architect, Karin Stelter. Her husband is an orthodontist in Germany, and she said, okay, sit down and think, what do you want to do with your practice? What is important? How do you see your future practice? And I thought this over, and I said, okay, Karin, for me, it's people who matter. I want my patients to be happy, comfortable. I want a parking lot. I want Wi-Fi in the waiting room. I want people to be happy to be in my practice. I don't want them to feel like they're being punished. I even want children to be comfortable, and also my staff should be comfortable. And I want to be able to work in good conditions with a good workflow, both for my practice but also for the use of technology. Here are a few pictures I want to share with you. It's very recent. I'm very happy about this project. There is a lot of decoration. It's a very nice place, very pleasant for everybody, so I'm quite happy with the result. There's something wrong here. There's something not working well. I can't move on with the pictures. Okay, never mind. So the aim is not only to make my patients happy and comfortable, but I also want my patients to be in a favorable situation when they come to the practice, so that they will listen to what we tell them, so that they can ask questions, and so that they accept the treatment more easily. I remember sharing this vision during a previous Genius Summit. I want to create beautiful smiles with the help of the latest technologies and with a competent staff. Just a second, because... okay, now it's working. Why am I telling you this story? I can't change the slides. Sorry. So why am I telling you the story? Because artificial intelligence, as you probably understood, is everywhere in our lives. When we listen to the radio, when we watch the TV, IA used to be for specialists only, but now President Macron says that he wants to invest a lot of money in companies that invest in artificial intelligence. I'd like to introduce Jonathan Tabé, who's the Research and Development Director for Clever Liners. And I have talked to him, and he's going to answer my questions throughout the presentation, and he will definitely be in a better position to do this than I am. So in my presentation, I'd like to define artificial intelligence. Everybody talks about it, but no one really knows what it is. So we have different types of artificial intelligence. We also have the role played by AI in orthodontics. And then I also looked at the patient's adventure, what AI can do for the patients, whether we should be afraid. I would like to talk about danger and ethics regarding AI. So what about the AI definition? Artificial intelligence is a technology that allows machines to learn and to adjust to new situations. And this is a very basic definition which is being used in many different industries and for medical purposes, ophthalmology, radiology, and dermatology. I have a patient who goes to vet school, and she was going to do her PhD on AI in the treatment of horses, and she said that AI can be used to monitor the animals' behavior, and also when there is an epidemic and the animals have an abnormal behavior, then they can be spotted more easily and the problem can be addressed more quickly. Regarding AI, there are different types of AI. We have this big bubble, there is machine learning and deep learning, and I asked Jonathan to explain a bit more clearly what the difference is. We don't have the sound, unfortunately. Okay, we can't hear Jonathan. Well, roughly speaking, the difference, I don't know if we can hear him. So I will start it from the beginning. Machine learning is a subcategory of artificial intelligence. It's the development starting from learning from a database with very specific characteristics to take decisions and make predictions, make forecasts. Deep learning is a subcategory of machine learning, and it focuses on neuronal networks to extract information which will be much more precise for data hierarchical representation, to give a better capacity to predict based on pictures or documents or text. Usually it's done from a huge database with a quantity of information that man would have trouble processing. That's the main difference between the two phenomena. I don't know if you really heard him well enough. And I forgot to introduce Jonathan Tabé. Jonathan graduated from the École nationale des arts et métiers. He's done internships in Canada and abroad on artificial intelligence. He has many different degrees, and he's in charge of clever liner development. So from what I understood, machine learning takes data to develop models and algorithms. As Emery was saying earlier, the data are provided to the system, and there are many different applications in daily life for cars, for autonomous cars, for robots. In the field of medicine, we can look for lesions, and also smartphones are evolving on a regular basis with artificial intelligence. Deep learning is slightly more complex, because for deep learning you have to train neuronal networks. It works a bit like a brain, a human brain. The neurons must be trained, and then with experience they will be able to perform more tasks. And in intelligence in general, intelligence is divided in two parts. There is generation artificial intelligence. It can generate text, images, videos, 3D pictures. Artificial intelligence is everywhere. It's pervasive in our daily life, and there are applications which are classified in a very important way to classify. They classify objects. It classifies objects to learn and recognize them. Artificial intelligence is also playing a role in segmentation and detection. So these are tasks performed by artificial intelligence. There is a limitless list of things that artificial intelligence can do. I wanted to show you this advertising for a brand of bathing costumes, and there was a big buzz here because the girl actually never existed. They did not take a photograph. They reconstituted the picture, and there were small imperfections in the eyes and the hand, but in the near future it will not be possible to differentiate between a real picture of a model and a reconstituted image of a model. That was an example of what can be done with artificial intelligence. It's very important that we understand the basics about artificial intelligence. So back to orthodontics. What about the role played by artificial intelligence in orthodontics? I like this picture. I seem to be waiting because we are at the eve of artificial intelligence development. So what is going to happen? AI can be a robot thinking, or what are we going to do? Are we going to work hand in hand with artificial intelligence? The future will tell us. In my daily practice, I find these three pillars very important. There are three pillars on which we can act to make sure that our patients are loyal to our practice before the appointment, during treatment, and after treatment. Before the appointment, you have to do something to make the patient want to come to your practice. During the treatment, you want the treatment to be performed well so that the outcome is satisfactory. And after the treatment, you want your patient to talk about your practice and advertise your practice. And you have to understand what artificial intelligence can or cannot do. Before the appointment, it's very important. The patient will contact you. How? Well, maybe because he heard from you about you from his dentist, his general practitioner. Maybe he heard about you through the grapevine. When I asked the patient, how did you hear about my practice? Mostly they say, I found you on the internet. So maybe there is a bit of artificial intelligence so that your name comes first on the list. There's also the French platform Doctolib, where you can make appointments with doctors and dentists. I don't know how much artificial intelligence is involved there. And there's also Google opinions. They will write reviews on how nice the secretary was on the phone and everything you did before the appointment. This is the patient's pathway. Once he has contacted the practice and made an appointment, he or she will then come to the practice. There will be the initial consultation, the impressions or scans, the x-rays, and finally the treatment plan. And you want the patient to be happy at the end so that he will recommend you to his friends and family. During the appointment, AI can play a role. For instance, artificial intelligence can answer some questions. In some companies have a system that will answer the questions automatically because they have a database with ready answers. I have not done it so far. And the first consultation for me is absolutely essential. The first appointment is when the patient is going to be able to talk, ask questions. That really matters because it will be the reason why your practice has many patients or not. During the first appointment, the human part is very important. The patient will fill in a medical questionnaire. It's an important moment because you will be able to listen to the patient and ask questions. And you can also give the patient a customized treatment. You know certainly that for adults it's not always possible to make an ideal treatment plan. You must find a compromise, surgery or no surgery, and what kind of treatment would be best suited to the patient's life. So you really have to listen to the patient, and it takes some time. Sometimes the appointment will be long. The artificial intelligence may be useful to collect data, but it will not replace the initial appointment, which I believe is absolutely essential. It plays an essential role also if you want the patient to accept the treatment, and obviously you want the patient to accept the treatment. What does acceptance depend on? Well, it depends on the practice, on the staff. The staff plays an essential role. It depends also on your own expertise as a clinician, and it also depends on how capable you are of listening to the patient, of showing sympathy and empathy. It's a mix of everything, and artificial intelligence, I believe, does not play a very big role at during this stage. The second phase is when you prepare the patient's file, when you take a digital and when you take an impression with an intraoral scanner. It's very important, and here AI will play a role because every day on the phone you hear data circulating, and in our practice, as Emeric was saying earlier, we communicate data. When we do a finishing phase, we give data. So you have to be aware that the data will play an essential role later in the process. This is Jonathan again. In orthodontics, we acquire the data with the intraoral scan. I remember when I was first treated when I was 12. They placed alginate in my mouth and I had to clench my teeth. Now it's no longer like that. There has been an evolution in the way data is acquired, and I believe that in the coming years we will not even use intraoral scanners. We will probably have images that will go directly, 3D images that will go directly into the patient's file. I'm absolutely convinced, especially considering the way the dental monitoring and 3D reconstructions based on a 3D image are progressing. This is one of the possibilities that artificial intelligence is making available. So you heard from Jonathan that he's already anticipating. He is taking the reasoning one step further. And maybe in the future we'll not even need to scan the patient's mouth. And you have to catch the train when it leaves the station. For radiographs, there are many software that allow you to analyze the radiographs. I'm not really using them so far, but in dentistry, for pan X-rays, for instance, there are many software that will detect caries or lesions, and the software will help you make the treatment plan or design the treatment and give the patient a quote. My son is also a dentist, and I discussed this conference with him, and he said that in the practice where he works, he was immediately offered to use this software to detect carious lesions, and he said he didn't like it because he felt that it was better to do a bite wing or a cone beam to spot the software to spot the carious lesions. But here we see that it imposes on us the type of treatment, and you lose your capacity to judge. So it is our responsibility here that is at stake. Whatever the software tells you, whatever artificial intelligence tells you, it does not replace your experience. And I think it takes a bit of experience and expertise to have your own judgment. I'm not saying that artificial intelligence will make mistakes, but I believe that you really have to be able to analyze the data. And it's interesting to hear from a younger colleague that he is not very comfortable with all these software. Now, once you have examined the patient and taken radiographs, you have to design the treatment plan. As we were saying earlier, the treatment plan is personal, it's customized. You can use artificial intelligence to collect the data and design a treatment plan, but you have to be able to use and analyze the treatment plan. I always make my own treatment plans myself. I set my own treatment aims, but it depends also on the patient's issue, what kind of issue. Is it a skeletal issue, a dental issue? And it depends also on the patient's wishes. AI will help us acquire the anatomic characteristics of the teeth. And there are here two possibilities which I find interesting: acquiring anatomical data on the teeth, and AI can provide the capacity for the software to learn the features of every tooth, and the treatment plan will be much more precise and much more adequate. When we give information to Invisalign saying I want to move this tooth, or I want to correct a deepened bite or an overbite or an open bite, there are several options. All these parameters are fed into the software, and based on the teeth anatomical characteristics, the software will modulate the tooth movement depending on this data. So the anatomical features have to be listed and captured adequately. So you see, it's very important that the data is acquired in an appropriate way, and also we have to have high quality data. I'd like to introduce this young patient, Camille, just so you understand that there are different options available. Camille is 12 years old. She has bimaxillary protrusion, labial incompetence. She has a chin retrusion. She's in class 2, and her arches are very tight. The pan X-ray shows that she has all of her teeth, including the wisdom teeth, and the profile picture shows that her teeth are proclined. Both the upper and lower incisors are proclined, and she has a huge skeletal issue, and her A and B angle is 11 degrees. I just wanted to illustrate what I was saying regarding artificial intelligence. The treatment plan may vary from one dentist to another. Some will decide to do surgery. Sometimes they will decide to extract to compensate for the retruded chin. Some will do nothing. But we should never forget it is our responsibility as doctors, as dentists. The final result will be your responsibility, and if the patient has a problem, he will consider that you're liable. Here I would like to show you the various stages. I treated these patients with the Genius system. I extracted the bicuspids, but I did not do any surgery. The parents would not hear about surgery, so I simply extracted the bicuspids. And I was gambling that there would be enough mandibular growth, but I knew that most likely at the end of the treatment she still would have a relatively small chin. This is the treatment. She has heavier and heavier arch wires, and I finally checked her at this stage to see how the incisors were doing, what orientations they were taking. This is the follow-up radiograph. The wisdom teeth will be able to erupt. Here we have upright the axis, and this is the follow-up. The extractions helped us upright the incisors, just to illustrate the fact that there are different treatment plans available, and you as a dentist or a practitioner should use your own judgment. This is when we remove the bracket. And here we explain that if we decided not to do any surgery, the result would not be quite the same versus if we had done surgery. Now, you have to explain all of this to the patient and his or her family. They have to be informed. This is the patient at the end of treatment, the final result. She was happy. She has a very lovely smile. Just to illustrate the fact that your own medical expertise plays an essential role. Regarding orthodontic treatments, we have different types of treatments available. Genius system brackets or clear aligners, Cleverline in the near future, I hope. And lingual brackets are also something that I do a little. Bracket and wire treatment. If you place your brackets yourself, you don't use artificial intelligence. But as Ephraim said yesterday, customized artificial intelligence can be important within the practice, and it will be more useful in the future for very accurate setups so that your brackets are perfectly positioned thanks to an indirect digital bonding. And I do a bit of indirect bonding, not for all my cases, not systematically, because I want the teeth to be the permanent teeth. I don't want to do this on milk teeth, and I want the patient to be able to choose the types of brackets. But I think that this is bound to change a lot in the near future. Now, clear aligner treatment, here, artificial intelligence definitely plays a role, and interestingly, you can already see the final result. You can make predictions, and as I said earlier, you can analyze everything you do in such a way that in Cleverliner the neuronal networks will work so that the system learns and improves. We can do this about the treatment, the final treatment generated from artificial intelligence, which learns from a huge quantity of data, will definitely provide an optimized final stage. And we know that in the final stage, many parameters must be complied with, alignment, occlusion, and all of this, when you learn from a good database, will be useful. The machine will be able to provide the best compromise for the treatment plan. Yes, obviously the database must be appropriate, otherwise the treatment will be offset. And here I would like to talk about Cleverliner. I asked Jonathan about Cleverliner, what kind of artificial intelligence Cleverliner depended on. Again, no sound. Well, in a nutshell, what he's saying is that deep learning will take care of the neuronal networks. So we're really talking about artificial intelligence for good, and we're not talking about algorithms and models. Here, segmentation. Romain Dureau yesterday was talking about segmentation and artificial intelligence. It is true that it is difficult to perform with artificial intelligence, and I'll give you a chance to listen to Jonathan. Well, you have to find a compromise with the alignment and occlusion. Maybe I can fast forward. Here we have a good example showing you how artificial intelligence started to be used in orthodontic research, especially with the segmentation. Most software, I'm not talking about Invisalign or the software that technicians use to make corrections. I'm talking about the kind of software that is totally independent. And until now, we have had to make many corrections on segmentation, but now with the new models, for instance, Mask MC Net, which was developed by the Probaton researchers, I believe it's going to be much more accurate. And here we have a good example with the mathematical formulae that will provide this kind of result. Again, I just wanted you to understand that artificial intelligence is not always used in all kinds of segmentations. There is a lot of manual work, but we have to make sure that artificial intelligence in the future will be able to do segmentation 100%. Predictive analysis, so we can analyze the patient's data, as we said earlier, and for us doctors, it can be useful to show us the final model so that we can compare different treatment plan options. It can be useful to reinforce the patient's confidence in our work, and with this, the orthodontist will do a better job. However, regarding prediction, I use Invisalign, and there are movements that are difficult to predict, and we need to use auxiliaries to be able to obtain those movements. Even in a clean check where you see the spaces closing, you know that thanks to your expertise, you know that it is not going to be that easy, and it won't happen by magic in the patient's mouth. As was said this morning, I use molar visualization, and it can't be done with aligners. You have to use mini screws and elastics. So I'm not saying it can't be done with aligners, but you have to use auxiliaries. Lingual treatment, nothing much here for artificial intelligence except the final setup, but that's very operator dependent. Artificial intelligence also helps us monitor the treatment. It plays an essential role in control and monitoring, and we can find that useful for orthodontics. For instance, we want to check whether the movements are adequate or not. Maybe there may have been a problem between two appointments, so we can use this type of monitoring system in order to check the patient's compliance and whether the movements have been achieved. I'm not using it really, but in the Invisalign software there is a control feature that can be useful for teenagers because it will help the patients and improve their confidence and trust in aligners. We can also use artificial intelligence to check problems between two appointments. Here, for instance, the tongue has been thrusting and has created an open bite, and if you detect that early enough, you can address the problem. But you don't want to spend all your time on the computer screen either. You have to find a compromise. However, artificial intelligence can help you when the appointments are far apart. You can be able to, you will be able to detect a problem between two appointments. In summary, advantages of artificial intelligence: more accuracy, problems can be spotted earlier, treatments can be optimized for each patient, you can save time and you can save money also because the treatment will be shorter. We have monitoring and control tools, and we have tools that allow us to predict the results, and that is one of the main advantages of artificial intelligence, and I think it's going to change in the near future for the better. But as I said earlier, it's all data dependent, and for economic purposes the data is very important. And also the data is normally protected by the GRPs. There are ethical and legal issues, and we have to be careful. And GDPR is a regulation that prevents you from disseminating data. Everything should be controlled, and we need to be trained. I don't think we are trained well enough on the data safety. Yes, people are talking about it, but I think we need to make sure that our practices are well protected against data breaches. And in the coming years, we have to be trained on artificial intelligence and on data protection. Artificial intelligence will not replace our skills and expertise, but it can support us, help us with treatment plans and with patient monitoring. In conclusion, I don't think we should be scared of artificial intelligence. Artificial intelligence is in our lives now, and it's here to stay. It will not replace our expertise as doctors and clinicians, but it can provide support. And I think that we will do a better job with artificial intelligence. However, the human relationship between the patient and the doctor is absolutely essential. It should be preserved, and that is the main difference between us and artificial intelligence. And the final conclusion will be that we should not go against the flow. Patients need to feel that you're listening to them, that you are going to help them. You have to catch the train when it leaves the station, and this is only the beginning of the AI evolution. And to finish, I'd like to show you again the inside of my new clinic. I think that I was right to want such a big clinic, because with artificial intelligence this is going to be extremely useful. Here we have little rooms where we can talk to the patients. That's it. Thank you, Catherine. Thank you very much. So you understand by now that we cannot do without artificial intelligence. It's part of our daily life. We don't even realize it's there. It's pervasive, and it will be increasingly present in our life.